Welcome back, everyone. You are enjoying another episode of Fast Facts Pharmacology Edition, brought to you by a Tale 2 hygienist in partnership with Elevate Oral Care. And now, please welcome your host, Tom Viola.
Hi, I'm Tom Viola, a certified pharmacist, dental educator, and author. Stick with me, and I promise to make the next few minutes the best pharmacology learning experience you've ever had. Hi everyone, Tom Viola from Pharmacology Declassified with yet another Fast Facts Pharmacology Edition. Well, this episode's going to be about thyroid disease. Got a lot of ground to cover, so let's get started. We have hypothyroidism and hyperthyroidism. Okay, what's the difference? Hypothyroidism is when your body can't make enough thyroid hormone to satisfy the demand. Okay, so it's an inability of the thyroid gland to secrete enough thyroid hormone, also known as T4, also known as levothyroxine. The way we diagnose hypothyroidism is by measuring your TSH, thyroid stimulating hormone. If your thyroid stimulating hormone is elevated, that means you probably have hypothyroidism. Okay, so what kind of symptoms? Well, you'd be fatigued a lot, right? You'd always tired, a little sluggish, maybe a little overweight, and definitely cold intolerant. Okay, well, how would I treat hypothyroidism? I would use something like Synthroid, synthetic thyroid, synthetic levothyroxine. So if your body's not making enough thyroid hormone, take some supplemental thyroid hormone. And that's exactly what we do. Okay, that's the most common way. Now, there are other variations of this. We can use natural thyroids like Armour thyroid. And we can even use T3, liothyronine, which will be converted slowly into T4. So there are ways to treat hypothyroidism with medications, but ask anybody who's had hypothyroidism or still has it, and they will tell you that they can spend a lifetime trying to find just the right dose of levothyroxine for them. Hyperthyroidism, as you might imagine, is the opposite. It's an excessive production of thyroid hormone. You're heat intolerant, rather slender, and definitely hot-wired, and you might have some protruding eyeballs, exophthalmos. Of course, in dentistry, what's really important to us is the fact that you have an increased sensitivity to pain and excessive sympathetic activity, which means we have to be really careful with epinephrine. Now, the diagnosis for hyperthyroidism, again, measuring thyroid stimulating hormone, you'd find it to be decreased, right? You'd have a low TSH. Okay, but back to the sensitivity to pain. As a dental professional who uses local anesthetics, you might want to give this patient, knowing they're more sensitive to pain, more anesthesia. That may be fine, but just be careful. At the same time, don't give them too much epinephrine, because epinephrine will only exacerbate their excessive sympathetic activity, and an excessive dose of epinephrine can release whatever excess stored thyroid hormone is in the thyroid gland, just waiting to be released, and that causes something we call thyroid storm. Definitely not something you want. The treatment for hyperthyroidism used to be medications, propylthiouracil, but that causes liver cancer, and methimazole or tapazole, which doesn't work really well in humans, but seems to work really well in cats. I'm not kidding. So, what do we do in that situation? Well, there's three alternatives. One, leave it alone. That's one track a lot of people choose. The second is to have the surgery to remove it, but it's really complicated surgery and doesn't leave a very attractive scar, although plastic surgeons have come a long way in that regard. And three is to do what? Take radioactive iodine, which means it'll concentrate in your thyroid gland and destroy it with radioactivity. I don't know if I want to go down that road either, but that's those are your options. So obviously we can treat these thyroid conditions, and we are pretty successful in doing it. And again, this is Tom Viola with yet another Fast Facts Pharmacology Edition. Oh, and one more thing. If you want to hear more from me, be sure to follow me on Instagram, Facebook, or visit my website at www.tomviola.com.
Thank you for listening to another episode of Fast Facts Pharmacology Edition, brought to you in part by Elevate Oral Care, creators of the innovative and proven prevention-focused oral care products from Advantage Arrest Silver Diamine Fluoride to Fluoramax Sodium Fluoride Varnish. Learn more by visiting www.elevateoralcare.com and schedule your free CE staff meeting today. We'll see you next time for another Fast Fact.